everybody, welcome back to my channel. In today's video I'm going to be talking about diabetes, what it is, the different types, some of the symptoms people may notice, the complications, and touching briefly on the management. Diabetes is when there is too much sugar in our blood. Now sugar is really important for us, it's our fuel, it gives us energy. We get sugar from certain foods which are broken down in our gut and then the sugar is absorbed into our bloodstream. However, having too much sugar or too little sugar is not good for us. To help regulate our sugar levels, we have a hormone known as insulin. This hormone is produced in our pancreas, which is an organ which sits high up in our tummy. What insulin does is it moves sugar from our blood into our cells, allowing the cells to be able to function properly by giving them the fuel they need. Diabetes happens when our body isn't producing enough insulin, or the insulin isn't working properly enough on the cells, and what this means is there's a pile up of sugar in our blood which isn't being moved from the blood into the cells. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is the one that tends to come on at a younger age, usually in childhood. It comes on much more quicker, over days or weeks. People with this type of diabetes have high sugar levels because their body just isn't producing insulin. Type 2 diabetes tends to happen to people who are overweight or obese. People with this type of diabetes develop it much more slowly, and that's usually over weeks to months. And with this type of diabetes, the reason why the sugar levels are high is because the body's not either producing enough insulin or the insulin is just not working properly. The main symptoms a person may notice when they first develop diabetes include feeling thirsty, needing to pass a lot of urine, feeling tired all the time, losing weight, which is unexplained. People with type 1 diabetes, and that's a type that comes on much more quicker and at a younger age, are more likely to experience these symptoms. Now, people with type 2 diabetes may not have any of these symptoms, or if they do, it may come on at a later stage after having high sugar levels for a few years and just not knowing about it. Test to confirm whether a person has diabetes or not is by doing a blood test. It's the one which we call a HbA1c. Now, that's a fancy term and you don't need to know it. You can just ask your doctor to do a blood test for sugars. Usually, if that blood test comes back high, then your doctor may want to repeat it again just to be sure. The reason why it's so important to control your sugar levels is because too much sugar in the blood can lead to complications. Now, these complications include short-term ones and long-term complications. In the short term, having too much sugar in the blood can lead to problems such as dehydration, where there's just not enough fluid in the blood. Particularly people with type 1 diabetes, they can develop a form of acid known as ketones in the bloodstream, which reduces the fluid levels in the blood. Now, this can lead to complications such as feeling drowsy, being unconscious, and it can be life-threatening. In the long term, diabetes is associated with complications, particularly when there are high sugar levels over a period of time, because high sugar levels leads to damage to our blood vessels. It can damage our smaller blood vessels, which supply our eye, leading to problems with vision. It can also affect the larger blood vessels, for example, the blood vessels supplying our heart, leading to them being furred. This can lead to complications affecting the heart. It can also affect other parts of our body, including our kidney, leading to kidney damage, affecting our nerves. It can also lead to damage to our foot. People with diabetes may notice that they have foot ulcers. Also in men, it can lead to erectile dysfunction. Now, despite all these complications, the good news is these complications can be either prevented, or if a person has them, they can reduce them by controlling their sugar levels. How do we treat diabetes? Well, firstly, for all people with diabetes, regardless of the type, it's so important to maintain a healthy lifestyle. That's by eating well and also by exercising. A healthy diet means having a balanced diet, one which is low in fat, sugar and salt, and high in fibre, for example, fruits and vegetables. Contrary to many myths, there's not necessarily a diabetic diet as such, but I would always recommend someone with diabetes sees a dietitian to understand more about foods and understand which foods are high in sugars. The treatment of diabetes depends on the type of diabetes. People with type 1 diabetes aren't producing insulin, so we need to replace that by giving them insulin, and this comes in the form of having injections. As for the treatment for type 2 diabetes, well, it will depend on how high the sugar levels are. Some people may need tablets to bring down the sugar levels, whilst others may need to have insulin similarly to type 1 diabetes. Today I don't want to bore you and go into all the details of all the different drugs, but if it's something that you are interested in, then do leave me a message. Maybe I can create a video and talk about that separately. Well, that's it for today. Thank you for watching today's video. I hope you found it useful. If you would like me to do a video talking about the different types of diabetes in more detail, then please let me know, leave a message down below. Also, do let me know if you have any suggestions on any videos you would like me to do. Till next time, lots of love and positive energy from me to you all. Take care and bye.